Did you know that there are a number of medical conditions that can lead to visual loss and even blindness that are strongly connected to the way you sleep? I am Dr. Jose Ramirez, a pulmonary critical care and sleep physician, and today I want you to learn and understand how sleep apnea can lead to these medical conditions and what to do about it. I'm going to go through a list and I'm going to briefly describe how these conditions affect potentially your sight. The first one is called glaucoma, particularly a type of glaucoma called open-angle glaucoma. Typically, glaucoma is caused by increased intraocular pressure, but in this particular case, this glaucoma basically affects what we call autoregulation and oxygen supply to the optic nerve. The eye relies on a small network of vessels that provide a constant flow of oxygen and energy, which are extremely important so that we can properly process visual information. If you affect oxygen supply and autoregulation, then the optic nerve start getting damaged. The second condition is called NION, and this might be a bit technical. NION stands for non-arteritic ischemic optic neuropathy. According to the Journal of Neuro-Ophthalmology, 70 to 89% of patients with this condition have undiagnosed obstructive sleep apnea. This condition manifests with painless, sudden visual loss. Patients usually wake up visual loss in one eye. And if you're thinking how this happens, this is basically like a stroke on the eye. So there's vascular insufficiency that damages the anterior portion of your optic nerve, which can be, of course, pretty devastating. There's something else called retinal detachment, which is basically the retina becoming loose, and that can lead to irreversible visual loss and damage. And the association was studied in Taiwan over a 5-year period. There's shifting between something called the vitreous and the retina, and those shifting pressures might lead to retinal detachment. According to the study, there's a 1.7-fold increase in the risk of this condition if you have untreated sleep apnea. Another entity is called retinal vein occlusion, and this leads to micro bleeding into the retina. This will manifest like with floaters. You see these spots, shifting spots, and this is caused by backup pressure into your eye. These blood vessels are very delicate, and this can lead to eye hemorrhages, which can lead to visual loss. And the last condition is something called papilledema. Patients with severe sleep apnea can have increased intracranial pressure, so the pressure within the brain is elevated, and this can affect a structure called the papilla, which is like the gate through which the optic nerve enters the eye. And if there's increase in this area, this can affect the oxygen supply to the optic nerve. There's another condition that might be looked as aesthetic. It's called floppy eye syndrome. The upper eyelid will become lax. The collagen of the upper eyelid gets damaged, and the eyelid sags and starts covering, more than what it should in the eye. And the problem is the eyelid can be easily retracted or even everted. So some patients might experience, the eyelid being reverted during sleep. Some patients might end, scrubbing the eye against the pillow and things like that. And this can lead to corneal irritation, even corneal ulceration and corneal damage. And many patients have to go through cosmetic procedures to try to fix the upper eyelid. There's a strong association between floppy eyelid syndrome and obstructive sleep apnea. So who needs to pay attention to this? Well, first, if you have any chronic eye condition, look into the symptoms of a sleep apnea. And if you suspect you might have a sleep apnea, then talk to your doctor so that he can screen you about it. The second group that needs to think about these conditions is actually doctors and medical providers, because this association is poorly understood and poorly known even within the medical community. The way our health is connected to sleep is really under-recognized, so I invite you to think about it. It's extremely easy to screen you for sleep apnea these days. Talk to your doctor, you can do a test at home, and if you treat sleep apnea, you can expect better outcomes, better health. You can even look prettier if the association is there. If you like this video, please like and subscribe. Thank you for taking the time. Much appreciated.